I guess the main thing to say about working together as a duo is that uh, it's not always welcome. Well, no, that's not true. It is quite often welcome. It can't always be resourced, and and sometimes it's not always welcome because people don't. Some institutions don't understand why you might need some reciprocal support in the room, and that's one of the reasons that we've evolved working as we work like in a mutually supportive way that benefits the projects that we're in, but also how we can um, be with each other and be in the work. And so I guess working at the Bethlem was one of the ways that we were able to test this working together more.
I guess the like generally in institutions that you are sort of given a role, like so if I'm like the dancing person or like making the dance or making the I guess it's like becoming like if I'm the artist and you're the producer,
Yeah, yeah.
then there's like certain expectations around what that is. But mostly when we're making something together, it's just us. And we are doing a lot of different roles. So it's like we're in different orientations depending on what is needed at that moment. So it's not so clearly defined. So I guess we're dealing with like what people are putting onto us in terms of expectations, but what's actually happening
Mm,
when we're creating something which is together.
yeah. And when we facilitate at the Bethlem, like in wards or in the hospital setting, we completely co-facilitate those sessions. We're both involved with both dancing, moving, like being with everybody. But yeah, people like you to be in a box, and I guess we don't like that, so we try in different ways to not be in that box, and that's one of the ways that we do. So in healthcare settings, care is directed towards the patient, and often, that there's kind of increasing dialogues about how to support healthcare workers, healthcare professionals, but that's kind of less the emphasis or how you might assume that that works.
Yeah.
And so for us, like I think care is a term that's sort of overused and misused by organizations. Like Daniel said earlier, you can say you do something without actually doing it, and it's much more within the action than the performing uh, the words of it. I think it's quite often also used as a plaster, like as a sticking plaster, like over something.
Yeah.
Care is embedded in our work, but actually, unless it's embedded in
Yeah.
communication and how you contract people and artists and information, and so I guess a lot of that for us is
Yeah.
about clarity or about transparency. We don't actually really use the word care. I think because we've both had it bad experience of it, but we don't really
Yeah.
use it in our
Yeah.
work. And that's not because we don't feel it. There is a lot of care
Yeah.
in what we do.
I think again it's just about the orientation of what care is because it's like towards like it feels still feels directional as like the normative towards the non-normative or the person who needs the care. Everybody needs care at different moments. So it's like for me it's just like it's the moving and the responding as well um, to where care is needed and what care is needed in that time, not like a pre prescribed idea of what care is and like who it's going towards.